Hi everyone, welcome back to my channel. When you wanted to simplify medical concept for your exam, and if you are medical student preparing for exit or licensure exam, you are in the right place. So don't forget to subscribe my channel for accessing the related video. This is gynecology and obstetric model exam. Question number 1. A prenatal client at 16 weeks of gestation present with complaint of vaginal bleeding, lower abdominal pain, and on her pervaginal examination shows the cervix is closed. So, which type of abortion does this indicate? A. Missed abortion, B. Treated abortion, C. Inevitable abortion, D. Complete abortion. The correct answer is B. The next question. Which of the following symptoms occur with a hereditary mole? A. Heavy blood red bleeding every 21 days. B. Fetal cardiac motion after 6 weeks of gestation. C. Benign tumor found in the smooth muscles of the uterus. D. Snowstorm pattern on ultrasound examination. The correct answer is D. The next question. The nurse is using a Doppler ultrasound to assess a pregnant woman. When should the nurse expect her fetal heart rate tone? A. At 7 weeks, B. At 11 weeks, C. At 17 weeks, D. At 21 weeks. The correct answer is B. The next question. The nurse would assess the client with fibroid uterus for which of the following manifestations? A. Abdominal swelling, pressure symptom, and infertility. B. Abdominal swelling, vaginal discharge, and dyspareunia. C. Uterine atrophy, vaginal dryness, dyspareunia. D. Uterine prolapse, infertility, abortion. The correct answer is A. The next question. When is the ideal time to start the investigation for an infertile couple? A. After 1 year, B. After 2 years, C. After 6 months, D. After 8 months. The correct answer is A. The next question. A woman at 32 weeks present with severe right upper quadrant pain, hypertension, and a thrombocytopenia. So, what is the likely diagnosis? A. Acute fatty liver of the pregnancy. B. HELLP syndrome. C. Cholestasis. D. Appendicitis. Let me repeat again. A woman at 32 weeks present with severe right upper quadrant pain, hypertension, and thrombocytopenia. So what is the likely diagnosis for this patient? A. Acute fatty liver of the pregnancy. B. HELP syndrome. C. Cholecystitis. D. Appendicitis. The correct answer is B. Hemolysis elevated, low platelet counts. The correct answer. The next question: which of the following is not an absolute contraindication to vaginal delivery? A. Complete plantar previa. B. Transverse fetal lie. C. Previous classical cesarean section. D. Breech presentation. The correct answer is breech presentation. The next question: what is the most common fetal complication of gestational diabetes mellitus? A. Fetal microsomia. B. Congenital heart defect. C. Neural tube defect. D. IOGR or intrauterine growth restriction. The correct answer is fetal microsomia. The next question: a 22-year-old presents with painless, firm, enlarged uterus and postcoital bleeding. What is the most likely diagnosis? A. Uterine fibroid. B. Endometrial cancer. C. Cervical cancer. D. Adenomyosis. The correct answer is cervical cancer. The next question: what is the recommended first-line treatment for eclampsia? A. Labetalol. B. Magnesium sulfate. C. Hydralazine. D. Diazepam. The correct answer is magnesium sulfate. The next question: which procedure is used between 18 and 40 weeks of gestation to detect fetal anomalies? A. Amniocentesis. B. Chorionic villi sampling. C. Fetoscopy. D. Ultrasound. The correct answer is amniocentesis. The next question: a biophysical profile score of 8 at 30 weeks of gestation indicates A. Fetus should be delivered within 24 hours. B. Client should be repeat the test in 24 hours. C. The fetus is not in distress at this time. D. The client should repeat the test in 1 week. The correct answer is C. The fetus is not in distress at this time because it is 8/10. It is normal. The next question: a labor client at +4 station requires A. Placing the client in bed to begin fetal monitoring. B. Preparing for immediate delivery. C. Checking for ruptured membrane. D. Providing comfort measure. The correct answer is B. The next question: the first intervention for variable deceleration on the fetal monitoring is A. Change the client's position. B. Prepare for emergency resection. C. Check for placenta previa. D. Administer oxytocin. The correct answer is A. Change the client's position. The next question: a postpartum client with a midline episiotomy prioritize nursing diagnosis is A. Risk for deficient fluid volume related to hemorrhage. B. Risk for infection related to types of delivery. C. Pain related to types of incision. D. Urine retention related to the periuretral edema. The correct answer is B. The risk for infection related to the types of delivery. The next question, in which time there will be increased growth in fibroid present in uterus? A. After menopause. B. Before menarche. C. During pregnancy. D. During childbirth period. The correct answer is during pregnancy. The next question, the client came with complaint of periodic lower abdominal pain, primary amenorrhea, urinary symptoms. The correct interpretation for this result is A. Imperforate hymen, B. Vaginogenesis, C. Ectopic ureter, D. Vestibular anus. Correct answer is imperforate hymen. The next question, a prenatal client presented to the clinic with complaints of vaginal bleeding, abdominal pain, and amenorrhea. So, what is her most likely diagnosis? A. Ectopic pregnancy. B. Fibroid uterus. C. Hydatidform mode. D. Complete abortion. The answer is A. Ectopic pregnancy. The next question, all of the following can cause first delay, except A. Inadequate knowledge about dangers and during pregnancy and labor. B. Cultural practice. C. Lack of money. D. Prepayment policy. The correct answer is D. Prepayment policy. The next question, which of the following is not a complication of diabetes? A. Preterm labor. B. Birth trauma. C. Oligohydramnios. D. Congenital abnormalities. The correct answer is congenital abnormalities. The next question, a patient at 20 weeks has a fundal height of 28 centimeters. So, what is the most likely cause? A. Wrong gestational age. B. Polyhydramnios. C. Multiple gestation. D. Any of the above. The correct answer is D. Any of the above. The next question, a patient presents with painful vaginal bleeding and a rigid uterus at 34 weeks. So, what's the most likely diagnosis for this patient? A. Placenta previa. B. Placenta abruption. C. Uterine rupture. D. Cervical trauma. The correct answer is B. Placental abruption. The next question, which of the following is the definitive sign of fetal death in utero? A. Absent fetal movement. B. No fetal heart activity ultrasound. C. No fetal Doppler sound. D. Decreased fundal height. The correct answer is B. The next question. A woman at 30 weeks present with painless vaginal bleeding. So what is the initial management step? A. Digital vaginal examination. B. Ultrasound to check placental location. C. Immediate cesarean section. D. IV oxytocin. The correct answer is B. Ultrasound to check the placental location. The next question. A 26-year-old present with severe nausea, vomiting, and weight loss at 10 weeks gestation. The likely diagnosis is A. Hyperemesis gravidarum, B. Normal morning sickness, C. Gestational diabetes, D. UTI. The correct answer is A. Hyperemesis gravidarum. The next question. A client with type 1 diabetes mellitus who is multi-gravida visits the clinic at 27 weeks of gestation. The nurse should instruct the client that for the most pregnant women with type 1 diabetes mellitus, A. Weekly fetal movement counts are made by the mother. B. Contraction stress testing is performed weekly. C. Induction of labor begin at 34 weeks of gestation. D. No stress testing is performed weekly until 32 weeks of gestation. The correct answer is D. Non-stress testing is performed weekly until 32 weeks of gestation. The next question. When preparing a teaching plan for a client who is to receive rubella vaccine during postpartum period, the nurse in charge should include which of the following? A. Vaccine prevents the future fetus from developing congenital anomaly. B. Pregnancy should be avoided for 3 months after the immunization. C. Client should be avoid contact with children diagnosed with rubella. D. The injection will be provide immunity against measles for 7 days. The correct answer is B. The pregnancy should be avoided for 3 months after immunization. The next question. A client with eclampsia begin to experience a seizure. Which of the following would the nurse in charge do first? A. Pad the side rails. B. Place a pillow under the left buttock. C. Insert a pad tank blade into the mouth. D. Maintain a patient airway. The correct answer is D. Maintain a patient airway. The next question. The multigravida mother with history of rapid labor who is in active labor calls out to the nurse. The baby is coming. Which of the following would be the nurse's first action? A. Inspect the perineum. B. Time the contraction. C. Auscultate the fetal heart rate. D. Contact the birth attendant. The correct answer is inspect the perineum. Inspect the perineum. The next question. While assessing the premipara during the immediate postpartum period, the nurse in charge planned to use both hands to assess the client's fundus to A. prevent uterine inversion, B. promote uterine involution, C. hasten the perineum period, D. determine the size of the fundus. The correct answer is A. prevent uterine inversion. Thank you very much for listening to me. Until next time, goodbye.